called Katie, left me a mule to ride. She called Katie, left me a mule to ride.
All right. Welcome to the Texas Hemp Show podcast. I'm Russell Dowden, your publisher and editor for the Texas Hemp Reporter magazine and host of the Texas Hemp Show. This week is podcast number 106 of the Texas Hemp Show, and joining us is this week on the program will be Dr. Matthew Brimberry. Matthew is an experienced physician delivering palliative care to patients throughout the Texas area. Currently serves as the medical director for the Texas Cannabis Clinic, and it's a telehealth and practice serving patients in and around the Austin and Houston, as well as Arlington areas in the entire state of Texas. And this is a telemed service. We're going to talk about pre-qualifying conditions and how you can get legal cannabis here in the Lone Star State. So, bringing us onto the show here, Dr. Brimberry. Thank you for your support of the Texas Hemp Reporter magazine, and welcome to the Texas Hemp Show.
Thank you so much, Russell. It's my pleasure to be here.
Well, very cool. Looking forward to chatting with you here. Let's get a little into the conversation here. I guess I'll kind of just jump right in there and ask you, how did you get into the cannabis side of things? First and foremost, you're a physician, but why go the cannabis route?
Well, I'm in a hospice and palliative medicine and have been for 10 years, and our patients have been using cannabis during that time. And I've seen the evolution from where patients were released from hospice practices because they're using cannabis to where it was incorporated, and we kind of looked the other way, all the way to where we could embrace it and give them access to that medicine. And it was in 2019 when they opened up the conditions through the Texas Compassionate Use Program that the Department of Public Safety gave me my certification to certify patients, and I've been certifying patients ever since. There's no lack of patients, Russell. There's a lack of physicians that know how to do it.
Well, I read a few, maybe a year and a half ago, at one point in the magazine, we published a list of doctors that were going to be prescribing the medicine for patients. I believe there was over 200, wasn't there?
There were. They still is. They're up over 600. However, just because a physician puts their name in with DPS and DPS grants them the certification doesn't mean that clinician understands the endocannabinoid system, has done any extra continuing medical education or gotten certified outside of DPS. It's not something that's taught in our graduate medical education program. You have to actually go out there and read books and get certified.
Yeah, I mean, we really didn't even know, Dr. Brimberry, about the endocannabinoid system until the early 90s. Was that right?
It wasn't in my medical school, and I went through medical school in the 2000s. There was I remember one poster on the CB1 receptor from the dental school. It wasn't taught when I was in medical school, no.
No, and science, modern science didn't even really know about it until the earliest 90s, and I believe it was a Canadian physician that made this discovery of our endocannabinoid system. Is it fair to say that the endocannabinoid system in not just humans, but it's in most creatures, I understand, isn't it?
If you have a vertebrae, you got an endocannabinoid system.
So where I'm going with this is I'm going to use a Star Wars vernacular. Is it the midichlorians? You know, if you hate the midichlorian philosophy of Lucas's epic sci-fi drama, but in some clinical way, it's like if they're part of our cells, the endocannabinoid system is inside of us. I'm just using a Star Wars reference here, but does that make you see where I'm going with that? I'm trying to make a connection there.
Yeah, some people are with the force. Yes.
Well,
I have a good feeling about this show.
well, thank you for being a part of this. Let's talk a little bit about the pre-qualifying conditions. What new ones did we get last session? There were a few, and I think one was. I think we got veterans was a big one. I think that we got. Can you talk on what we got, what we had prior to the last session, and what we got recently in last year?
So, previous to 2019, it was intractable epilepsy and pediatrics. And then after 2019, that's when I was able to participate. And I was the first physician that DPS let in because they allowed terminal cancer, ALS, muscle spasticity, multiple sclerosis, and a whole host of neurodegenerative conditions. Also, they allowed autism. That's when I got involved because predate that you had neurologists and these terminal cancer patients that were at home didn't have access. So that's how I think DPS allowed me to get in there so I could help out these folks that other folks weren't going to be able to get to. Then in 2021, they presented chronic pain, PTSD,
That's
and
right.
all forms of cancer. And that made it through the House to the Senate, and then they took out chronic pain and just left us with PTSD and all forms of cancer. And they raised the cap just a little bit.
Yeah, just up to one from 0.5. And my mother, bless her heart, just recovered last year from cancer, and she's got neuropathy. I know Mom qualifies for this medicine, and as a former hippie who smoked it enough in the 60s and 70s, you'd think she at least could handle some 1%, for her neuropathy. But this is getting better, it seems like, on what we're allowing for. One of the things that we talk about in between sessions is allowing for maybe the lobbying for doctors having discretion of the amount of THC. Is that something you support, Dr. Brimberry, on your end? Maybe allowing for a 3% THC or giving the doctor I don't know how lawmakers do that, but maybe they max cap it at 5%, but give the doctor some freedom to prescribe.
We have a lot of patients that do really well with the 1%, but a lot isn't everybody. We also have patients that really need some concentrated medicine, and I don't think that 3% will get us there. I don't think 5 or 10%. I think it's north of 25%. Rick Simpson oil will get to, at 10%. If we could get some 20 to 25% cap, that'd be great. In my honest opinion, it should be the physician's discretion on what that should be.
Yeah, that seems some other states have programs like that where the doctor can choose, right? Yeah, that seems to me the way the keep our government out of our health lives and allow the doctors to make those decisions for us.
I keep track of my patients and that's the beauty of this program is that the physician gets you qualified, and it's a bona fide patient-physician relationship. There's a certain amount of Delta-9 THC that we're allowed to prescribe, that we allow you access to, and then we follow up with you and we see how you're doing. And we can see the benefits of this medicine, but we can also see the shortcomings, and the shortcomings, in all honesty, are limited by that cap, and also what conditions were allowed into the program.
Well, hopefully this next session, Dr. Brimberry, will be able to get, a little more cap on that. Maybe they'll give us a little more THC on that, and give you guys at the physician level a little more freedom. Can we talk a little bit about costs for patients, and what is this? I understand when they come aboard with your program, it's like a 6-month program. You're good for medicine for 6 months. I understand, right?
Yes.
Okay.
Yes. So we have, when patients apply, we go through their records, we see the patients, and once they're qualified, we give them a personalized treatment plan. And that initial, the amount of work that takes, we cover our costs with just a little bit of overhead and a little bit of margin. We're able to get patients certified for $180. We do run specials every once in a while. So EMS, firefighters, veterans, we can give them a 20% discount and break even. But yes, that's our current operating costs is 180 for that first visit. Now that takes usually it's a 20-minute appointment. If somebody's transferring from out of state, and believe you me, we have people coming in from all over the country to go to MD Anderson, and they can't bring their medicine. If you're coming in from out of state, we accept transfer patients at $110, which is our typical follow-up charge, because that's only about a 10-minute.
And I just want to throw that in there. I'm with this overhead shot here. There's a 20% off. They have an ad in the Texas Hemp Reporter's brand new issue on page 11, folks. So if you're watching the show or listening, there's a 20% off if you text TXHEMP or Texas Hemp to their phone number, which is how you set up your appointments. That's 512-892-7092. And that promotion ends at the end of January, so I want to thank them for that, for marketing with us, but also remind guys, check that out. And I want to get my mom to try this for the neuropathy. They give her gabapentinol and a lot of meds that I'll give her problems with her stomach and digestion. What have you seen with people with with those symptoms? How does the cannabis help them?
It about 9 times out of 10, it works very well. And I want to, Russell, it not only helps after you have neuropathy, there are studies showing that platinum-based chemotherapy agents, which are some of the most toxic for the peripheral nervous system, that you can prevent the neuropathy if you can get your hands on some cannabis before starting your chemotherapy.
Oh, wow, really interesting. Well, what we've been noticing lately is my father has gotten old, now in his mid-70s, and he has gotten a little bit of Parkinson's on his right hand, which is his drawing hand. And when we gave him, Dr. Brimberry, we gave him some THCV, and it really helped that. Does the gummy form in 1% also known to help any patients of yours with Parkinson's? I don't know if that's a pre-qualifying condition just yet, but it's
a neurodegenerative, yeah.
So that falls under neurodegenerative. So have you seen anybody like that with the Parkinson's side? Because I noted that some of the over-the-counter products that my father, I've given him, has helped him as well with some of that.
The beauty of being able to get full spectrum products with your THCV and your THCA. The products that are coming from the dispensaries, they're going to be isolates, and none of them are going to be cold pressed. And so with those isolates, you're going to miss out on some of those full spectrums. That's why if we could get to 10% and get some RSO, we could get some of that. As for my personal experience with Parkinsonian patients, we've all seen the YouTube videos of a gentleman with tremors, and he uses some flour and his tremors goes away. I've found, unfortunately, that it's not so much the tremors that we're able to treat as the anxiety, the insomnia, and the decreased appetite. With that being said, though, Russell, I will tell you that in a few of our Parkinsonian patients, it is the thing that helps with their tremors.
Yeah. I was at an event not too long ago, and I picked up some of that medicine for Dad, and just sent that off to him. I haven't spoken with him to see how that's going, but he's in another state, and I think he qualifies for cannabis even where he's living in Utah. So we have an interview with you guys in the magazine too, and I wanted just to point that out, that's currently out there. You can pick this up, guys, and learn more about the Texas Cannabis Clinic here in the current issue that's just available. And these magazines went to Houston, Dallas, Austin, the Rio Grande Valley, as well as San Antonio, this particular issue. So it's Texas Cannabis Clinic is how you can look these guys up in the magazine and find out a little more about them. Can patients grow cannabis at home in Texas? That's not part of what our laws are, right? I pulled this from your frequently asked questions on your website, Dr. Brimberry, and I'm just pulling one or two of these out there for the listener that in Texas we can't grow anything.
That's right. Not yet.
Not yet, not yet. But also, what about insurance not covering cannabis just yet in Texas?
That is correct. Yeah, it's federally illegal, so we can't charge Medicare or Medicaid for these evaluations, and you can't use your insurance to pick up the medicine at the dispensary either.
What would you like to see happen in the next session, Dr. Brimberry, with the 88th legislation coming in here to January? This will be my second full session as a advocate here in this space. We came on board in early 2020, and so this next session will be a big one for me. Is I feel I'll be able to get down there and maybe be a little more active down there on Congress Avenue. What is it that you guys on your end would like to see happen with more freedoms with the legislation session coming up?
Well, long term, we would love to see no cap and let the physician decide whether or not a patient should qualify. Within this session, I think what's reasonable is extension of that cap up to 25, 50%, and then opening it up to a few more conditions. Hopefully, the number one condition that medical cannabis is utilized for across the United States, and that is chronic pain. It's the one that we have the best evidence on.
Mm-hmm. Yeah, chronic pain. Also, it seems to do great help for our veterans with PTSD, and I'm sure you see that as well.
Russell, when PTSD got approved last year, I was part of a study group. It's a survey of veterans, mm-hmm. and we brought on 14 veterans into the program on September 1st. And we followed them for 90 days. Yeah. And we watched as their PTSD symptoms were reduced by 50%. And they stayed on the same amount of cannabinoids at that 3-month mark. I've now, since it's been a year, I still see these veterans, and we are having long-term data. They're having amazing long-term success with this medicine. And if you compare this to the pharmaceuticals that are out there, and I've given presentations on this, how it is 3 times more efficacious for PTSD than the pharmaceuticals that they're getting at the VA.
Yeah, and that's really a powerful part of this plan and this whole debate on this treatment. But I think it's very empowering for our veterans to get the best help that they can. And you know what? Just off topic, a tad off. I know a doctor that's at Baylor Medical Center that's doing trials with low doses of, I guess, psychedelics with treatment with veterans. And so I know it's on the research side of the Baylor Medical Center, but I happen to know a doctor that does treat veterans with PTSD and other conditions with low levels of psychotropics. Is that something you've heard about?
Oh yeah, no, that comes from my academy, the Academy of Hospice and Palliative Medicine. Mm-hmm. That's typically where some of these experimental things happen, is when people don't have much time left and we don't have time to mess around with long-acting medicines. We try something that's quick-acting, and absolutely, we've got evidence on MDMA, psilocybin, and the like, and we have outstanding results. And we are going to see the foundations of psychiatry change over the next 2 to 5 years. They're already preparing clinicians to learn how to administer those medicines as they're rolling through the FDA, and they're finding that, number one, they're extraordinarily safe. Number two, they're very effective, much better than what we've had before when it comes to treating things like refractory depression and PTSD.
Well, I'm friends with a Dr. Jackson up in Dallas, Fort Worth area in Arlington, and he's with Baylor Medical Center, and he's doing really good stuff with the program that he's doing with low levels of MDMA and other psychotropics. And so I think that the culture is also shifting with that, with lawmakers in Washington too. I mean, you're starting to hear more the more accepting of alternative medicines now more than ever here in 2022.
Yeah, we need it.
Well, we absolutely do. Shout out to listeners. How can folks get involved and be a part of this program? I guess fire off the website or shout that number out again and let folks know, Dr. Brimberry, how they can get their medicine. That's the Texas Cannabis Clinic.
Absolutely. So if you think that you qualify or you have a neighbor or family member, you can go to texascannabisclinic.com and apply. And you may wonder, well, how old is too old? What condition doesn't qualify? How young is too young? We have patients that are in their late 90s. We see every condition that is certifiable in the state of Texas. And we are all trained to see pediatrics as well, something that you won't see in other cannabis clinics. Some of our youngest patients are well under a year old. And so we are versed with this medicine, and that's how we fit in to your community, is helping guide patients through the process of getting certified and also helping them titrate their medicine to the right effect so that they get a good response.
Well, we appreciate your time and being with us here on the Texas Hemp Show podcast. I know you've got a Christmas party to get to, so I'm not going to keep you holding up much longer. But thank you so much for what you're doing, and we hope to see some better laws get passed here with this next session in the 88th. And for more information, visit TexasCannabisClinic.com. And remember, if you call, and all of this is telemed, right, Dr. Brimberry? I mean, isn't this all just telemed, getting over the phone or on a conference with you, right?
Absolutely. You do it in your living room with your bunny slippers on. Call us, and we'll get you certified.
Yeah, you don't have to make an excuse that you can't go down there or travel all the way across town. You don't have to do that with these guys. You just pick up the phone, schedule your telemed visit, and get that thing in. So, Mom, you can't blame this one on no one took you down there or anything like that. Get on the phone there, 512-892-7092. Thank you, Dr. Brimberry, for being a part of the show.
And thank you for all you do.
All right, Merry Christmas to you guys. All right, we'll be back on the other side. It's the Texas Hemp Show podcast, number 106, and we will be back after this and read some news and talk a little bit about the new edition of the Texas Hemp Reporter magazine. I'm Russell. We'll be back after this. Your Bank for Life, we understand the unique struggles this emerging market creates for early adopters. We love working with innovative entrepreneurs on the next big thing, and we believe hemp is exactly that. For over 130 years, we've been getting to know our clients and helping them plan for their future. Come tell us your story and plans for your venture. TFNB Bank, your bank for hemp, proud to support Texas farmers. Visit online at tfnbtx.com.
Hey, this is Cheech Marin, and you're listening to the Texas Hemp Show.
Why take a chance with your hemp grow? Join Hemp Plan and avoid the risk. TPS Labs' exclusive hemp monitoring program. Hemp Plan members get one-on-one consulting from knowledgeable consultants who are available when you need them most. If you want to take the guesswork out of growing hemp and focus on what matters most, call TPS Lab today and ask for your free consultation. Take the next step to a successful harvest. Visit tpslab.com or call today at 956-383-0739.
Hey, this is Tommy Chong, and you're listening to the Texas Hemp Show.
Would you like to be a guest on the Texas Hemp Show? Get your products or services featured on the Texas Hemp Show podcast and the Texas Hemp Reporter magazine. Over 10,000 downloads available on Instagram, Amazon, Spotify, iTunes, and YouTube. Grow your business with an editorial about your services in the magazine, packaged with your display ad in print and online. 120,000 copies available statewide in all cannabis and CBD retailers in Texas. Would you like to be on the cover of the Texas Hemp Reporter? Ask about our media opportunities by emailing texashempreporter@gmail.com. Now, back to the show.
All right, welcome back to the Texas Hemp Show podcast, number 106 this week on the program. And I thought I would tribute that to the Metachlorians there, as Dr. Brimberry had a little fun with me on the Star Wars reference. But no, welcome to podcast 106. The magazines are available in, so far, Austin, Texas. We are in Houston this evening, and we delivered to Dallas, Fort Worth area. DFW get them tomorrow, but we did make them available in South Texas already this week. Austin, parts of San Antonio will get them next week. But this week, our latest edition of the Texas Hemp Reporter, the fate of Delta 8 in Texas. We've got an article in here on the benefits of microdosing edibles. We talked about edibles last week on the program. New Mexico doing wonders. We're no stranger to this. We cover this and deliver the magazines often to New Mexico, but years ahead of Texas and the cannabis industry. That's covered by Cameron from Michael Best's attorneys. Some of the top attorneys write for us, whether it's Lisa Pittman or Chelsea Spencer or Cameron with Michael Best. These guys all write, but great article also this month from Shada Tarabi. If Texas legalized adult use cannabis tomorrow, who would get the license? And this is very interesting story because we talked about this at the Texas Hemp Summit up in College Station a few weeks ago there, but it was eye-opening to see, how these licenses are and what Texas would do with real cannabis, a real cannabis program. And anyway, let's so the magazines are out. Just want to point these out. We want to let people know that they're out there. If you get these in the mail, some of you do get those in the mail. And just wanted to let folks know that they can pick that new edition up as that's getting out there to folks here, the final edition of the 2022 year. So, but with the end of the year comes a new year, and we will have a legislative session coming up in January. Our lawmakers get back to making decisions that affect us all, and very often during the session coming up in the new year, we will check in with our friend Jay McGuire from the Texas Hemp Federation and get updates from him. And Jay had something. He slid into my inbox on Tuesday of this week and asked if he could come on and make an announcement. I said certainly. So welcome again to the program from the Texas Hemp Federation, Jay McGuire. How are you, Jay?
I'm good. How are you, Russell?
Good, man. Good to have you on the show. We just said goodbye to Dr. Matthew Brimberry. And got him to talk to us a little bit about pre-qualifying conditions for folks with legal medical cannabis in the Lone Star State. So had a nice chat.
That's so important, and I know that the advocates for that cause are going to be in the Capitol along with us.
They certainly will, and we talked to him about what he might like to see with, expansion of for veterans and getting more medicine availability and getting a little less restrictions for those guys on that end. So what news do you have from the campfire there at the Texas Hemp Federation, Jay? Give us your report.
Russell, thank you for having me on. As we discussed in the last podcast that I spoke on, Senator Charles Perry of Lubbock, predictably, has introduced a bill that would effectively ban the manufacture of hemp-derived cannabinoid products in the state of Texas. So I think your audience probably is already aware that you can't manufacture you can't manufacture hemp products in Texas. This places a percentage limit equal to that of other hemp products. It conforms. It's Senate Bill. Eyes are getting small. I don't want to get it wrong. 264. Mm-hmm. So, simply put, and my message to your audience today is to pay attention, Please contact us because we are coordinating grassroots efforts as we speak. We are looking for small businesses, medium businesses, and large businesses. The small businesses, I think, can be most effective by allowing us to coordinate message and communications with their own members of the legislature. The other piece of this, of course, aside from phone calls and emails, is we want people to come and visit the Capitol with us. Our job will be to target members of the relevant committees, and as I said before, to pair constituents with their own legislators. So please contact me at mcguire@texashempfederation.com. And as always, Russell, thank you so much for allowing me to come on your show and rattle the cage and try to get people active.
Yeah, no, it's always good to get your insight, and you and I spoke earlier in the week about me getting a little more active and getting down there and agitating and just saying the right things. I was a little hesitant last session, but I feel a lot more educated in this space about it as a member of the media, Jay. And I've got some things I'm doing with some marketing, and we want to be certainly a lot more visible down there.
Russell, let me just interject one note of caution.
Sure.
Use the word agitating, and that is absolutely the kind of thing that citizens feel they have the need to do. I mean, you want to be heard, you want to express your frustration. However, we have to be effective in order to beat back the prohibitionists. And so one of our jobs here is to help people in crafting their message in a way that will be heard. I'm not trying to put words in your mouth,
but maybe not agitate. Agitate's not the right way to say that.
we never want to go in hot.
Yeah.
We want to treat the process and the members and the staff with the kind of respect that we would want ourselves.
Certainly.
Because I've seen in the 30 years I've worked in this legislature and others, as well on Capitol Hill, people sometimes get in their own way. Inadvertently, and they're doing it honestly. But that's why you talk to professionals like us, and we're here to help. And hopefully, if we all pull together, we'll at the end of this legislative session, we'll come out with another victory under our own.
Well, you know what I'd like to see, Jay, and you might be influential in this and helping me get this done. But I've been on the phone with some lawmakers in the last year or two, but I would like to see more of those guys come on the show. And educate them. I think it wouldn't hurt for some of the lawmakers, to come on the program, field questions from our staff or maybe our guests. Have you co-host a show where we have some of these important decision makers in our legislature answer and educate, and maybe us educate them, even as well. So I think I'd like to see a little more of that in 2023 from my staff and our production, where we actually get some of those decision makers on the show. I think it'd be good.
Well, that's a really good idea, Russell. I think your audience needs to hear from their elected officials directly instead of having it interpreted by people like me and you. Sometimes, and to take some of the mystery out of why the legislature does what it does and how the process works. It's very easy to get confused about bills getting referred to committees and bills not getting hearings and bills not getting set on calendars. And sometimes the only people who can really explain that are the members themselves. Yeah. So, the opportunity to put them in the hot seat a little bit to get them to declare their positions on the items that matter to us, like whether or not we're going to be able to continue using hemp-derived cannabinoids like Delta-8 and the others in this state. So many people rely on these products to cope with the everyday stresses of life, with anxiety, with depression, and all the other things that we all know about. So that's our mission.
Yeah, and let's get those guys in the hot seat. It's good to get those guys in the hot seat and let them explain their position on these on these topics for laws that come up with these bills. So
well, I tell you what, Russell, I'll make you an offer. If you can get Senator Charles Perry on the show, I will. No, sir, this is no joke. I will debate them on this issue.
Okay.
Gladly.
Okay, so try to get Charles Perry on. I don't know that he was one that I talked to last time, but I reached out to several of them, and several called back last session. But I would like to get him on, maybe get him on to debate with you. That would be a great idea, and maybe we can make that happen. I just want to reach out, and when you make a call from a magazine or a show, they know they need to call back because they don't know what you might write or say about them if they don't. So sometimes I found that they do call back when I ask them to. So
I think a respectful exchange of views,
certainly,
and perhaps challenging of assumptions and facts it will clear a lot of things up, because I'm not convinced that Senator Perry is right about some of the things he believes about us, and I hope that he would be open to changing his mind about some of it.
Well, we will see, and we will have you continually check in throughout the new year when we get into session, Jay, and we look forward to hearing your reports and some updates with you throughout 2023. Thank you, my friend, for chiming in on the show this week.
You're welcome, Russell, and have a good evening.
All right, good evening to you too, sir. All right, that's Jay McGuire from the Texas Hemp Federation. If you want to email Jay, please send him an email at mcguire@texashempfederation.com and learn more about his good work that he does protecting all cannabinoids from being removed. I'm Russell. It's the Texas Hemp Show. This is podcast 106. Next week on the program, I don't know who I've got because I can't see it from here, but I believe it is the... I've got Texas True Distributors and Ross. My friend Ross is going to be on talking about his Texas weed water. And then our friends on the 22nd will be ATX CBD delivery. I'll be doing that one without Carl, but I'll be doing that one from home. Carl taking some time to be with his family for the holidays. And then we'll be back with Gulf Coast Hemp Farms at the end of the year. So you guys stay safe out there. Happy holidays, and we'll see you next week for another edition of the Texas Hemp Show. Be on the lookout at all your CBD and smoke shops for the December edition of the Texas Hemp Reporter magazine. These are available all throughout CBD and smoke shops throughout the state. So Houston, Dallas, Austin, McAllen, San Antonio, all getting these here in the month of December. So good stuff, and we'll see you guys next week for another podcast of the Texas Hemp Show. We'll be back after that. Thanks, guys.